It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime. Take a leap and live healthy. Eat well. A, be active. P, live mono every day.
Aloha, and welcome to another episode of Foundations for Healthy Generations, a program produced by the Hawaii State Department of Health for and about public health issues. I'm your host, Laurelyn Salamanca of the WIC program. Last month, we talked about food safety and the issue of illegal roadside food vendors. We asked the public to help us identify these illegal food vendors to help the department ensure proper licensing and safe food preparation. Today, we'll be talking with Mr. Gerald Ota, the Affirmative Action Officer of the Department of Health. Our topic today is the rich history of public health in our islands and how public health in Hawaii has changed over the decades. Today, we're fortunate to have with us Mr. Gerald Ota, a 40-year veteran of public health. Thank you so much for being with us, Gerald.
Thank you very much.
Yeah, before we get started, I'd like to hear a little bit more about how you got started in the department, what you're passionate about.
Well, my degrees are education related, and I've always been interested in history in that sense, but my job basically entails discrimination law, and I deal with employment and services. And I started off as a field representative at the personnel office.
Okay, well, I'm in awe about your service record with the state, 40 years. And in those years, what things might you have seen differently?
Well, I can say that when I started, I used to write the script for the director for his award meetings, and I used to go and see the old personnel files, and they used to have yellow carbon paper and we used to use manual typewriters with automatic returns, or actually electronic typewriters with manual returns, and we had IBM punch cards as our computer-based technology at that time, so things have progressed quite a lot since that time.
I think most of our audience might not even know what an IBM punch card is. Yeah. Well, you're here to discuss about the public health history on our islands. Can you tell us a little bit more about that?
Well, over 150 years ago, King Kamehameha III was trying to address basically a smallpox problem in Hawaii, and he appointed three physicians in the community, three community leaders, to explore whether or not there should be some other body, and they recommended, this is the Privy Council, a body of his making, that a Board of Health be constituted for the Port of Honolulu. In 1850, the Royal Legislature passed an act saying that there shall be a Board of Health, and by 1853, a law was made to extend the coverage of that board to all islands. So from that basis, we all normally say that we are the first state Department of Health because we predate every other state's Department of Health if you take us back to 1853.
Wow. And I mean, what does that really mean that Hawaii had the first state Department of Health?
Well, I'm not sure what it means in terms of actual health issues when compared to other states, because I think you need to do a different kind of comparison. But I think because we were an organized kingdom back into the early 1800s, maybe even earlier than that, when King Kamehameha unified all the islands, we had a kingdom which looked out for its people. And in that sense, government structures were built upon that, which would then address those needs and concerns that the king had for his people and the people had also.
And I think that's a snapshot of our past. And then today, we have a logo that I think embodies some of those things, or a lot of those things. I'd like to hear a little bit more about our logo today.
Okay, so one of the things I'd like to say sort of in preparation for talking about that is that our premise is public health is the kind of work that needs to be done to help protect the health of everyone. So public health is work worth doing, and we're in Hawaii, and Hawaii is a place worth staying. So we have some special issues, I think, in Hawaii that we want to address. And if you look at what our vision is healthy people basically in healthy communities and healthy islands. And our vision is more than just Hawaii itself. It's Hawaii and the Pacific and the world that we have to deal with. So our logo deals with 4 elements. One is you see a petroglyph in the middle of the logo, and that's representative of the people that we're trying to address the health of. But it also involves and includes various other aspects. For instance, the taro is, or kalo is the source of the Hawaiian people. So protecting our source and protecting our sustenance as a people is very important to us. So that's, again, our people. Then you have breadfruit, which is at the very top of the logo, which basically represents the Pacific and the outer world. And it's what the importance of the outer world is to our own health, as well as what we can mean to the health of the world. And lastly, we have the ohia leho on the left side of the logo, which represents the aina, or the land, or the environment, because one of the first things that comes out after a lava flow is the plants, and that includes the ohia leho, which is symbolic of our environment.
I'd really like the symbolism that's incorporated into the logo, and I think reaching our goals to better our community and better our state is very important, and learning more about our past, about our history, our public health history, is important to know where we are now and where we're going to be going. So could you share more about our public health history then?
Sure. Many people, in fact, there's a famous saying that says past is prologue, and our sense is that the history can inform our present, and it also tells us where we've been, maybe where we shouldn't go again. But what I want to point out in history, in the slide that we have about public health pre-contact, is that many people sometimes feel that public health did not come to Hawaii until Westerners came. And our position is, in fact, the Hawaiians, Native Hawaiians, had a powerful system of kahuna and other advisors and experts that informed the people as to how to live appropriately. So for instance, we sometimes say the kahuna lapa'a, or the general practitioners, the herb doctors, were the general practitioners of the time. And this goes back to prior to Captain Cook. And that Western contact that we describe only comes from 1778. And we're really talking going back all the way to 600 or even earlier, depending on who you talk to. And on the next slide, on population decline of Native Hawaiians, you'll see is that most of our early explorers made an estimate that we had a very robust people here. And generally speaking, most people look at about 200 to 250,000, although there's some people more recently who described that there was possibly up to 800,000 Native Hawaiians here. Wow. Prior to Western contact. Okay, by the 1850s, that Native Hawaiian population had become half. And that was primarily because of the impact of diseases on Native Hawaiians, things like cholera, venereal diseases, mumps, flu, the kinds of common things that we might overcome very easily these days, but were hard to do at that time. In 1820, on the next slide, the missionaries started coming, and the first known Western-style doctor, Thomas Holman, was a medical missionary at that time. He soon left, however, and then most of the medical missionaries that we're familiar with came in the later part of that decade. What might be of interest to people next is the next slide shows Honolulu in the 1800s, early 1800s. And that slide shows Kina'u, who is the namesake of our administrative building in Honolulu, Kina'u Hale. In the middle of the picture, she was the premier or the kuhina nui for King Kamehameha III. And if just for interest's sake, the building in the back is Kauai Hau Church. Oh. So then if we move to the next part of our history, the Board of Health, as I pointed out earlier, was established by 1853 for all islands. But its impetus was, again, just to repeat, smallpox epidemics. There were worldwide smallpox epidemics, and there's another big one in the 1850s, and that's probably why smallpox was always an issue.
I mean, it's very interesting that some of these diseases that were of concern back then are still some public health concerns now.
It's interesting because smallpox is one of the few diseases that the World Health Organization and experts consider to be eradicated. the only viable smallpox are now in research collections. So hopefully it'll be soon done for polio, but it's not yet done for polio.
Yeah.
Okay, the next slide shows where many of the king's guests met, and that house, just interestingly enough, is called Hale Kawila, and it's the name of the street where the house was. So in this picture, what is shown is Kinau is in the center with the king, and with the captain of the American vessel on the right, and the captain of the French vessel on the left. If you notice, smallpox was very much the issue then, and if you go to slide number 13, you'll see the first known public health measure in Hawaii. And I'm sorry, first known written public health measure in Hawaii. We don't know what was happening prior to then, but in our records, and if you can see here from the photo we made, there's a big archive stamp on it, and that's where we got the this little bill that said if you were a captain, you had to stand outside the harbor until your ship was inspected, and you could not enter the harbor, and you could not stay in the harbor. We found smallpox on board. So you can see here that our early kingdom, and in fact even later into the kingdom, our ali'i were very involved in trying to provide a healthy environment, a healthy place for their people. So as you can see, the Queen's Hospital was established in 1859 by King Kamehameha IV and his queen, Queen Emma. And what you might not know is that they went house to house in the neighborhood to solicit donations from the populace to fund the establishment of what is now called the Queen's Hospital. Wow. So the Queen's Medical Center is the current day inheritor of that legacy. And I just wanted to note here that the ali'i were very involved in trying to provide for their people in various aspects to make sure that they were a healthy and robust people. So for instance, King Lunalilo established Lunalilo Home. In fact, you might know that in Hawaii Kai, but they actually was elsewhere before that. Queen Liliuokalani established Queen Liliuokalani Trust for children, for destitute children, for poor children, for Native Hawaiian children. Queen Kapiolani is the namesake of what is now the Kapiolani Medical Center for Women and Children. And actually, the children's part of that comes from another hospital that was established by a family on Kauai in memory of their son who died of tuberculosis at a young age.
So these are some, I think, models for us now in our current time to aspire to, and it feels like they have left, an indelible mark in public health. And
they are still leaving a mark. In fact, I forgot to mention the one last one, which many of us probably know best, which is Kamehameha School's Bishop Estate, founded by Bernice Bawahi Bishop, and that was for the education of Native children and children, but particularly Native children. So there was a holistic look at trying to provide for the community.
I'm also curious as to what might have changed, or what was the effect when immigration happened, or immigration to the islands started to happen.
Well, as I mentioned before, the Native population had really gone downhill. Had been halved and was very decimated. Was a very low amount. So what happened was, when the business factors came in, they realized they needed a source of labor for the kinds of industries they wanted to build. Primarily in the 1830s, 1840s, it was sugar. So they looked for who could immigrate, who they could get to immigrate, who would provide labor for the plantations. And you'll see on the next slide that it has certain acts which then encouraged immigration to Hawaii. And you'll see here the numbers of people that immigrated to Hawaii. In fact, at one time, Japanese were 40% of the population of Hawaii. That's no longer the case. It's actually the fourth largest group at this point. And this is only some of them because, for instance, I've left out the Koreans who came in the early 1900s and the Puerto Ricans who came about the same time, and they came in about 5,000 or 7,000 people. So there are many groups that came in, and some of them are not reflected here. But the point is, this was one of the reasons for this was to repopulate Hawaii. One of the other reasons, of course, was more merchant-based, and it was to populate the plantations. So what happened was, in fact, King Kalakaua actually at one point proposed an alliance between Japan and Hawaii, and he proposed that one of the Japanese princes marry Princess Kaiulani. Of course, she didn't want that, and he didn't want that, so that never happened. But that was to maybe basically put the two island nations together. Okay, as you can see in the next slide, this is just an illustration of another very strong plantation economy, and this is the pineapple industry. The pineapple industry actually started in the early 1900s, although pineapple was introduced by Don Francisco Marin in the early 1820s, I believe. But it took a long time for them to realize that there was commercial potential in pineapple. Now, we talked about smallpox some. I wanted to talk about some of the other issues that we're well known for, maybe not necessarily positively, but in some ways now positively. And one of them is Hansens Disease. Hansens Disease is called Mai Pake because some people thought it came from China. And Pake is a label we give to Chinese people. And then Ho'oka'awale, Ohana, which means it's a separating sickness of families. And what happened in the old days was because you were moved to Kalapapa or moved to the treatment facility, you were moved away from your family. So it separated families. And you can see on the slide that the Kalapapa didn't start until the mid-1860s. And what we're familiar with, of course, is that Father Damien, now Saint Damien, and Mother Marianne Cope, now Saint Marianne, were people who served the people at Kalapapa and gave their lives for it or in service of it, and are now very famous worldwide because of their service.
Right.
Another issue here is you will see that bubonic plague was another big issue. In fact, the reason why most of us remember it, other than the fact that it is one of the issues of medieval interest, the Black Plague and the rats and that kind of thing, but it also was the source of one of our signal events, if you will, in Hawaiian history, was the burning of Chinatown. Some people feel it was a racist decision. Some people feel it was also a misguided attempt by public health officials from the Board of Health to control using what was at the time thought to be a way to control the plague, which was to burn out the infestation. And they set small controlled fires, which in fact worked for a while in terms of doing what it wanted to do. And then the fire got out of control in 1900. And it burned down the entire area roughly from what they said Queen Street, which is now Nimitz Highway, to Kukui Street, north of Beretania Street, to River Street, which is Nuuanu Stream, and to the east to Nuuanu Avenue. So that entire huge square area was basically burned to the ground. If you go to Chinatown now, you'll see that most of the buildings date from after 1900.
Well, what sort of diseases that immigrants might have, or not that the immigrants themselves, but that came with the immigration, I suppose, after that?
Well,
like tuberculosis, I know is something that maybe some folks might be more familiar with. And more recent.
Tuberculosis actually was a major issue in worldwide in the 1800s. In fact, it was commonly called consumption. But it was and still is a disease of interest, and the disease that we monitor and try to treat and moderate and control And in the early 1900s, every county had a TB sanatorium or TB hospital established. Kauai's TB sanatorium is now Samuel Mahelona Memorial Hospital, and that if you look at there, you can see the way the thing was built, and it was built with the wide walkways and places that people could rest in the open air, like Leahi Hospital, which is the Oahu TB sanatorium, like Kula Sanatorium on upcountry Kula, which was the TB sanatorium for Maui County. On the Big Island, Pu'umaili was the TB sanatorium, but it was by the old airport and it's no longer in existence because it was heavily damaged by the 1946 tsunami, and was what was left of it, or what became the treatment facility, is I think believed to be Hilo Medical Center now, Hilo Hospital.
Okay. And if we just fast forwarded a little bit more into the 80s, well, a lot more into the 1980s and the 1990s, I guess some of those issues that came up during those decades that you remember?
Well, of course, there were many mileposts that spanned the time, but if you want to just look at the last few years, the last 40 years or so, in the 1980s, of course, we became very interested in environmental issues. So by that time, for instance, this picture here you have of the biplane flying up spraying DDT would no longer occur because DDT became banned as a pesticide for the control of mosquitoes. And you can see this in this picture, the plane is flying right over our vector control workers, which is probably not a good public health practice.
Unfortunately for them, yes.
Yes, unfortunately for them, unfortunately for us actually, because there's a lot of effects. In 1980s, I think for most of us that lived in that period, you will remember the heptachlor episode, in which the green shop that was used to control ants on pineapples were contaminated the milk. And then, of course, 1983 was the start of the current killer whale eruption, and we had volcanic fog or VOG that we still have from time to time. The AIDS epidemic started in the 80s. We call it HIV now. And for those of you who are interested in what we call Obamacare now, the Department of Health established the state health insurance program, and that reduced the uninsured rate to 3%. Recently, it went back up to about 8 to 9% because of our cuts and that kind of thing. But certainly, hopefully with the new law, things will improve again. And then 1990s was Iniki, and we then started to get much more programs to try to standardize public health practice nationwide. So this big acronym you see here, the National Public Health Performance Standards Program, that's what that stands for, is one of those things. And the other thing is here, you can see we had several suits for state hospital, for children's mental health, for adult mental health, for developmental disabilities, which improved then the way we serve these different populations. And that's what you see in the 1990s. In the 2000s, we had 9/11, we had the anthrax scare, we had bioterrorism as a major issue. We continue to have bioterrorism as a major issue. And hopefully now we're because of the impetus of our current director, we're seeking accreditation, and one of the things the foundations hopefully will do is help us move toward that in a more organized manner. And so accreditation is one of the things that we want to do in the 2010s, if you will.
Okay. What would the accreditation achieve, by the way?
Well, I think it depends on who you talk to, but one of the issues, of course, is it'll set standards for our practice so that we can aim toward and make sure that our performance of how we do public health meets the highest kinds of standards in the country and hopefully in the world. But certainly what we want to do is assure people that what the kinds of policies they're getting, the kinds of programs that are provided to the public, for the public, by other people, by us, meet the best standards in public health. And this is what accreditation hopefully will achieve, will be among the things that it will achieve for us.
Okay. It's been an eye-opener to hear everything in a succinct manner, the history of public health, and seeing how, government and then the populace will shape the policy. And then I think those cultures, environments have also shaped what we are now, and it's very unique to us, and it's good to know that it's continuing on as well.
Well, we all think Hawaii is a special place, so we continually think that it will continue to be unique to us. But one of the phrases that we often use in public health here at the school as well as in the department is public health is everyone's kuleana. And what we mean by that is it's not only a right, if you will. Many people think they have rights in terms of good health and that kind of thing, but it's also your responsibility to exercise healthy lifestyles, to do good practices yourself, as well as take part in making sure that the rest of the community is healthy.
Yeah, thank you that was a great summary, actually, a wrap up. So, and thank you again for joining us today. Thank you again to the audience. Thank you for joining us on this episode of Foundations for Healthy Generations. We hope to see you on our next episode, and we'll see you again. Ahui ho.
Gotta get up. It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime.